Welcome to the channel. Stress and the best essential oils to fight it. Stress is your body's way of responding to any kind of change or demand or threat. Stress can be positive, keeping you alert, motivated, and vigilant. It can also help you rise to face challenges. It's what keeps the mind and your concentration sharp and focused. For example, when you're about to do a presentation or when you're studying for an exam when you'd rather be watching a movie. But beyond a certain point, stress stops being helpful and starts causing major damage to your health, mood, productivity, relationships, and quality of life. Stress becomes negative when you are continuously pressed with challenges without relief between stressors. As a result, you become overworked, fatigued, and stress-related tension builds. When you sense danger, whether it's real or imagined, the body's defenses kick into high gear known as the stress response, also known as the fight or flight response. The stress response is the system of protecting you. When it is functioning properly, it helps you keep focused, energetic, and alert, including in emergency situations, giving you extra strength to defend yourself, for example, or prompting you to step on the brakes to avoid an accident. However, this response can become chronically activated during prolonged periods of stress. Prolonged activation of the stress response causes wear and tear on the body, physically, mentally, and emotionally, and increases your risk for disease such as heart, lungs, immune system, cancer, cognition, liver, gut, and mental health. Aromatherapy essential oil blends also help to distress and rejuvenate your health. Experts think aromatherapy activates areas in your nose called smell receptors, which send messages through your nervous system to your brain. The oils may activate certain areas of your brain like your limbic system, which plays a role in your emotions. They could also have an impact on your hypothalamus, which may respond to the oil by creating feel-good brain chemicals like serotonin. The following essential oils, lavender, rose, citrus family, and mint family, are most effective in managing stress. Essential oils are made from flower, herb, and tree parts like bark, roots, peels, and petals. The cells that give a plant its fragrant smell are its essence. When an essence is extracted from a plant, it becomes an essential oil. First, lavender. Lavender is the most highly researched stress-reducing essential oil. In a human study of stress from taking math tests compared to a control group, lavender aromatherapy decreased two stress markers: cortisol, the stress hormone, and chromogranin. In 60 coronary artery patients in the ICU, inhaling lavender essential oil for 2 weeks increased sleep soundness and lowered anxiety. In a study of 90 open heart surgery patients, results show that lavender oil inhalation resulted in a nearly 11% variance in anxiety and 70% decrease in blood cortisol. A hot foot bath with lavender essential oil or EO produced a substantial increase in blood flow and relaxation. Pain, anxiety, and satisfaction, which are stress-related symptoms, were significantly improved by lavender aromatherapy with patients with an IV catheter inserted before surgery compared to a non-lavender control group. 15 pre-surgery volunteers who underwent lavender aromatherapy have experienced a significant decrease in their stress levels, bispectral index score, and pain intensity of needle insertion, and lessened stress and increased relaxation in 20 healthy adults. Second, rose. Rose oil has significantly decreased breathing rate, blood oxygen saturation, and systolic blood pressure in a study of 40 healthy adults compared to the placebo group, felt calmer, at ease, and likely to sleep than in the control group. The use of rose oil aromatherapy reduced the severity of pain and anxiety in the first stage of labor in a labor and delivery study of 110 women. In animal studies, there is evidence of rose oil's anti-stress effects. In a 2015 study, children inhaled either almond oil or rose oil after an operation. The patients in the group that inhaled rose oil reported a significant decrease in their pain levels. Researchers believe that rose oil may have stimulated the brain to secrete endorphins, often called the feel-good hormone. Based on the outcome of this study, the researchers suggested that aromatherapy using rose oil could be an effective way to soothe pain in surgery patients. Studies have also found that rose oil triggers the release of the chemical dopamine, which researchers believe plays a pivotal role in helping to relieve the symptoms of depression. Research experts recommend opting for an aromatherapy massage to treat depression rather than inhalation. It may take up to 8 weekly sessions before you notice a change in the depressive symptoms, so you may need to exercise a little patience. Third, citrus family such as orange and bergamot. Compared favorably to lavender oil in reducing fatigue is the orange oil from the citrus family. Petitgrain or bitter orange aromatherapy can improve work performance by decreasing stress and increasing focus and alertness. A statistical analysis of 200 dental patients in the waiting room has shown that both orange and lavender aromatherapy groups with 50 patients each had reduced anxiety and improved mood. Women exposed to orange EO or essential oil had a lower level of anxiety, a more positive attitude, and appeared calmer than men. And the aromatherapy group of both men and women was more relaxed than the non-aroma group. Orange oil also lowered stress and anxiety for women in labor. Citrus-based bergamot aromatherapy combined with listening to mellow music showed improved relaxation in experimental research of 119 healthy young adults and in 57 eligible participants waiting for mental health treatment. The bergamot experienced 17% higher positive emotions than the control group. Next, the mint family. The mint family has very aromatic members including rosemary, thyme, sage, and peppermint, which shows stress-related benefits. Both rosemary and lavender oils effectively lowered cortisol in 25 healthy subjects. 33 employees in a chemical plant who drank rosemary-infused tea showed an indicated positive effect on reduced stress, fatigue, and mental fatigue related to their work. Exposure to rosemary compounds also led to decreased depression and anxiety while performing tests in a mice study. Inhaled linalool used on mice displayed anti-anxiety properties and resulted in improved social interaction and decreased aggressive behavior performing tasks. Linalool-rich EO such as lavender, sage, rosemary, marjoram, orange, and bergamot increase relaxation and repels anxiety. Peppermint oil is high in menthol and it has improved performance on demanding cognitive tasks and reduced mental fatigue related to the extended task performance in 24 healthy adults studied. It has also enhanced memory and alertness in a study of 144 volunteers. Research also says that having kids eat peppermint candy during tests helped them perform better while reducing their stress. Participants exposed to the aroma of peppermint and peppermint oil show enhanced memory, increased alertness, and processing speeds according to the International Journal of Neuroscience. According to Theresa Molnar, Sense of Smell Institute, which is the research and education division of the Fragrance Foundation, scents can have positive effects on stress reduction, sleep enhancement, self-confidence, mood, and physical and cognitive performance. Peppermint enhances mental and athletic performance, cognitive functioning, digestive processes, and pain tolerance, according to Brian Rodenbush, Wheeling Jesuit University. Hence, can improve the quality of life for many people. Furthermore, a study on the effects of peppermint and cinnamon on drivers conducted by the Wheeling Jesuit University showed the following remarkable results. First, peppermint is a contributor to decreased anxiety and fatigue while driving. And second, peppermint and cinnamon are associated with decreased irritation and higher levels of alertness while driving. Aromatherapy blends. Research shows essential oil aromatherapy blends improve stress-caused symptoms. An example includes terminal cancer patients who reported less pain and depression with aromatherapy hand massages when compared to a control group. Similarly, 20 arthritic patients who were treated with an aromatherapy blend of lavender, marjoram, eucalyptus, rosemary, and peppermint reported lowered pain and depression levels. A comparative research study on the impacts of lavender oil, an oil blend of lavender, sage, and marjoram, and acupressure massage further showed reports that quality of life was improved with each intervention, but sleep improved the most with a combination of blended aromatherapy and acupressure massage. In 42 hypertensive patients, the aromatherapy group lowered their systolic blood pressure and heart rate variability when compared to the control group. For 52 hypertensive clients, lavender and bergamot blend lowered psychological stress responses, serum cortisol levels, and blood pressure. 20 healthy subjects who had bergamot and lavender oils rubbed on their bellies have a significantly decreased pulse rate and blood pressure and self-rated as calmer and more relaxed compared with the placebo group. Burn patients also reported decreased pain and anxiety from rose and lavender aromatherapy. In a meta-analysis of 12 research experiments, aromatherapy of different blends was found to be an effective sleep treatment and reduced anxiety and depression in 4 trial studies of postmenopausal and elderly women. In addition, dementia patients showed cognitive functional improvement when treated with aromatherapy, and those with Alzheimer's had the highest gains. De-stressing with EO aromatherapy. A holistic picture of aromatherapy's benefits emerges when increasing numbers of human studies are combined with previous animal research of essential oils and stress. While aromatherapy may not be the magic cure-all, it does appear to have proven effects as a stress reliever. Aromatherapy can be a nice method for stress relief because it has few known side effects, can be used passively, and can be easily combined with other stress relievers such as massage or meditation for increased stress relief. Aromatherapy products are also widely available, making aromatherapy a convenient option, especially for busy people. Thank you for watching the channel. Don't forget to like, comment, and subscribe.